Oocyte cryopreservation in a transgender male adolescent. Definition. Fertility preservation is the practice of improving the chance of biological reproduction in individuals when a significant risk of infertility is predicted. Gender affirmation therapy, both hormonal and surgical, is one of the indications for FP because gender-affirming hormones adversely affect fertility, and gender affirmation surgery may involve the removal of gonads. International guidelines recommend that healthcare personnel should discuss FP plans with transgender individuals before starting gender affirmation therapy in adults and adolescents, or puberty suppression treatment in children.
A tiny needle is placed through a small incision in the belly button and used to inflate the abdomen. The needle is removed and an instrument guide, also known as a trocar, is placed through the incision into the abdomen. A camera is then inserted and is able to watch two additional trocars as they are placed in the right and left lower portion of the abdomen. The surgeon looks at structures in the abdomen and around the ovary to make sure the surgery can be safely completed. Generally, for small children, the entire ovary is removed, but for older girls and women, it is possible to remove only the outer layer or cortex for preservation. The ovary is grasped and a surgical energy device is used to separate the ovary from the fallopian tube. The ovary is then placed into a pouch and removed from the abdomen. If only a portion of the ovary is being preserved, the laparoscopic scissors are used to dissect the cortex from the rest of the ovary in strips. The tissue is then placed in a pouch and removed for processing. The surgeon confirms the surgical site is without bleeding and completes the surgery. If the whole ovary is removed, the specimen is sent to pathology for evaluation prior to tissue processing and freezing. The ovarian cortex is then dissected from the ovary, cut into 1 to 2 centimeter tissue strips, frozen and stored for future use. When the patient is ready to attempt pregnancy in the future, the small ovarian tissue strips are thawed and placed back into the pelvis by laparoscopy. In this first technique, scissors are used to make a 2 to 3 centimeter incision in the peritoneum or lining of the abdomen. The thawed ovarian tissue strips are then placed into the space and sealed. Another technique involves placing the ovarian tissue strips directly on the remaining ovary and suturing the tissue in place. The size of the ovary will determine the number of strips that can be placed using this technique. The patient is typically able to be discharged to home the day of the surgery. After transplant, return of ovarian function is monitored through blood work over several months. Once function is confirmed, the patient can proceed to attempt pregnancy naturally or with fertility treatments if necessary.
Applications on medicine. Oocyte cryopreservation involved no sperm is a choice that offers trans men full anatomy over their gametes with fewer ethical concerns. Vitrification is the preferred method of oocyte cryopreservation as it offers comparable pregnancy rates to those of fresh oocytes. Mature oocyte cryopreservation has, in recent years, transitioned from an experimental procedure with poor success rates to a robust means of preserving unfertilized eggs.
As I get older, it seems my well-meaning aunts always ask, when are you going to have a baby? You're not going to be young forever. Well, Aunt Gail, I might not be young forever, but there is a way I could keep my eggs young for quite some time. Hey everyone, Julia here for D News. Over 30 years ago, doctors successfully grew an embryo from a frozen egg. Back then, it was considered experimental and used for women who might undergo chemotherapy or other medical procedures that might harm their eggs. These women could freeze their eggs and use them at a later date. Now it seems to be all the rage. Women delay pregnancy for all sorts of reasons, like focusing on school or career, or just waiting for somebody to settle down with. But they still worry about fertility, so now the egg freezing trend is taking off. One egg freezing company hosted a cocktail party in New York to advertise their business. And big tech companies like Apple gives its employees up to $20,000 towards egg freezing as a health benefit. While it's growing more common, it's still really expensive. It can take about $10,000 just to freeze your eggs, then a few hundred more bucks just to store them every year, and a couple more thousand to thaw them and undergo in vitro fertilization treatments. So it still remains a treatment mostly for the wealthy. And besides the cost, it's a pretty intensive process. It's not like they just pluck out your eggs and put them in a freezer. Nope. You have to take hormones for a few weeks to stimulate the ovaries to release a few eggs, which can leave you feeling bloated and a little bit off. You get regular checkups to see how the eggs are coming along, and then the procedure to remove the eggs sounds not that nice at all. It's kind of like drawing blood. A needle has to pierce your vaginal wall and reach the ovarian follicles and retrieve the egg. Okay, ouch. Thank God you're under a little anesthesia. Once the eggs are removed, they're cooled to sub-zero temps and stored. But the freezing process does a little bit of damage. It makes the shells harden, which can make fertilization a little tricky. But using a technique similar to IVF, sperm can be directly inserted into an egg, bypassing the hardened shell. But since this whole thing is kind of new, no one really knows how long eggs are good for, although one clinic successfully used 7-year-old eggs. The process can't boast a high success rate. According to the American Society for Reproductive Medicine, one egg has a 2 to 12% chance that it will develop into a fetus. So doctors recommend freezing a few eggs. Some women freeze a dozen or so for later use. So with all the high cost and low chances, why do people do it? Freezing your eggs is a kind of pause on fertility. Women are born with all the eggs they'll ever have. They don't produce them throughout their lives like men produce sperm. So you either use them or you lose them. According to the American Society for Reproductive Medicine, women are most fertile in their 20s. Fertility declines gradually through the 20s and 30s, but the decline picks up speed as women enter their late 30s. As a woman ages, she loses her eggs through ovulation and through a process called atresia, which is a gradual loss of egg-containing follicles. Even the eggs that remain degrade over time, and the risk of birth defects increases. By the time a woman is in her 40s, only 10% of her eggs are good, and the chance of a successful fertilization drops to below 5%. With chances this low, it's no wonder women hedge their bets by freezing their younger, healthier eggs. While this might seem like a ladies' only issue, gentlemen, you shouldn't wait to have kids either. Check out this video here to find out why.
Other studies in the last decade have found that as men get older, random mutations appear in their sperm cells, which might be a cause of the increased risk of autism.
Would you ever freeze your eggs, or do you have another science question? We'll save some of your best questions to answer in future videos. So like this video and subscribe to our channel so you don't miss your answer. And as always, thanks so much for watching D News.
Pros and cons. Pros. The principal advantage of social freezing is the ability to delay having children. Cons. A disadvantage, apart from the cost, is the high rate of multiple pregnancies following artificial insemination, resulting in elevated risk of complications.
A common request now is for women to freeze their eggs. We have seen the requests for egg freezing increase dramatically over the past 5 years. The reason for this is that the technology now exists to freeze eggs effectively where it did not exist before. In egg freezing, a woman undergoes in vitro fertilization with the use of specialized medications that stimulate the ovaries to release more eggs. Those eggs are extracted under anesthesia from the ovaries, and the eggs are then placed in a special media where they're evaluated by the embryologist. The process of stimulation and extraction of eggs takes approximately 2 weeks. Once the eggs are extracted, they are placed into liquid nitrogen within certain special vials that are protected against the very cold temperatures. The eggs are frozen at a very low temperature so that they have no biological activity. Should the woman desire to use these eggs later in life, she would then go back to the reproductive endocrinologist and undergo a treatment with hormones to prepare her uterus to receive the fertilized eggs. At that time, she would of course need a sperm donor, either her partner or a donor sample from a cryobank. The sperm would be thawed or produced fresh by her partner. The eggs would be thawed and fertilization would be conducted in the laboratory. Once the fertilized egg occurs and an embryo is formed, the embryo can be transferred back into the uterus. Egg freezing is available to women who need to delay childbearing to a later age, who are in a situation at this time where they have no male partner. It is also offered to women who need to undergo chemotherapy for rheumatologic diseases like lupus or rheumatoid arthritis, Sjogren's syndrome, or Behçet syndrome. Also, it is offered to women who need to undergo chemotherapy or radiation treatment for certain types of malignancies. So egg freezing is available to women for medical reasons as well as social reasons. It can be very effective, but like other forms of in vitro fertilization, is most effective when done at younger ages, typically under the age of 35. Speak to your physician about the possibility of egg freezing in your life.
Issue applied in Ecuador. In Ecuador, there are 13 assisted reproduction centers. 7 of them operate in Quito. This is recorded by the Ministry of Health, which does not have information on how many of them maintain ovulus in freezing or vitrification, as they are not an element of sanitary control and issuance of permits.
Cryopreservation is a fundamental tool in assisted reproduction. The protocol for embryo freezing was standardized in the early 80s. However, when it comes to oocyte, it was much more challenging because insufficient results were consistently produced until barely a decade ago when we introduced vitrification. The initial failure obeys to a variety of reasons, but I would say that the main reason is the oocyte itself, because this is a large cell, very sensitive to chilling injury and much more prone to ice formation. The reasons for the striking success of vitrification lie essentially in its ability to prevent ice formation. Today, we count on a variety of tools and methods for vitrification as a result of the hard work of notable cryobiologists to produce the successful protocols we have these days. We introduced vitrification in our ovum donation program in 2007 with the aim of validating the technology for its later introduction in the routine clinical practice. So initially, we studied the embryo quality produced with vitrified oocytes, but it was later in 2010 when we proved the efficiency of vitrification within a randomized clinical trial. In this trial, we showed comparable outcomes between fresh and vitrified donations. Since then on, oocyte vitrification has been widely used in many IVF centers worldwide, not only for ovum donation with the clear benefits of easier logistics and the possibility of stay-warding the quarantine period, but also it's been used in infertile patients and in women seeking for fertility preservation. So fertility preservation is today a reality thanks to vitrification. This is a quite new discipline in assisted reproduction, which brings women the opportunity to save their fertility for the future. This is mostly useful in a particularly sensitive population of cancer patients needing potentially gonadotoxic treatment, or for women who wish to delay motherhood for different reasons. We have learned some useful lessons during 10 years of applying elective fertility preservation, and today we can say that vitrification provides a means to increase the chance of having a biological child. But these chances depend on the age and the number of oocytes vitrified. We have observed a systematic reduction in success rates as the age increases. The calculation of cumulative life birth rate according to the age and the number of oocytes used by a patient is a very useful tool for gynecologists in order to counsel women seeking for fertility preservation. So finally, we can say that today vitrification is a consolidated technology that has meant a breakthrough in our field, not only to treat infertile patients, but as a way available to modern women to help them to continue with their professional and personal development with the probability of safeguarding their chances of having a child in the future whenever they decide. And we can proudly say that with our work, we have helped this come true.
Conclusion. An increasing number of transgender people are seeking fertility preservation therapy, yet access to treatment is still limited. Laws, regulations, financial status, and social climate are currently major factors influencing the decision to undergo fertility preservation. There are many clinically approved methods available worldwide, including sperm cryopreservation from transgender women and embryo and oocyte cryopreservation for transgender men.
Hi, I'm Dr. Barad, and we're going to talk a little bit about egg freezing. In our field, we've been able to freeze gametes for many years. First we were able to freeze sperm. That's been going on for humans only for about 25 years, something like that. But freezing eggs was a bigger problem. And the problem is because the egg is a big ball with a single membrane, and in the older way that we used to do egg freezing, or we used to try to freeze eggs, ice crystals would form, and those crystals could break the membrane and pop the egg like it was a big balloon. And so a lot of eggs that we froze couldn't survive the freeze and the thaw process. A technique called vitrification, which literally means turning the fluid that's in there into a suddenly turning into a solid, glassy kind of substance, doesn't form ice crystals in the same way that the older method did. It's kind of the difference between just freezing something in an ice tray and making gelato, the nice, smooth, beautiful gelato. So the vitrification process doesn't form these big ice crystals, and the eggs really these days survive really quite well. So how does this work? What do you have to do to freeze your eggs? Well, in the natural cycle, you're only going to make a single egg, and going through the whole process for one egg doesn't make much sense. So a woman who's chosen to freeze her eggs needs to take medications so that she matures several eggs to make the most utility out of this out of each experience.